Has anyone ever heard of an ABLE account? If so, raise your hand. Okay, that's pretty good. How many of you have or know someone who has one? That could be better. All right, so today we're going to go over everything you could want to know about the plan, but feel free to ask questions. In short, ABLE accounts help people with disabilities save money without losing their state or federal benefits. There are many important programs out there like SSI and Medicaid that say if you have more than $2,000, you can't get those benefits anymore. And Medicaid pays for important stuff like a job coach or assistance to do daily life stuff, things that all of us need to live independently and to get working. So this was functionally forcing people with disabilities to live in poverty to get their basic needs met. Thankfully, Congress eventually realized that wasn't the best system, so they passed the ABLE Act, which allowed states to create ABLE accounts and allow people with disabilities to put money in there and not have it hurt their SSI, SSDI, Medicaid, Medicare, SNAP HUD housing assistance, even the FAFSA. So if somebody goes off to higher education, this won't impact their financial aid. So now someone can save up to $18,000 a year. If they are working, they can save even more than that. There are a couple rules, but they can save up to $34,770 in 1 year. So someone can have up to $100,000 in this account and still get SSI and everything else. And that's really been a game changer for people. Instead of being constantly worried about having less than $2,000 and spending down, they're now able to save for bigger, important stuff in life. Now let's talk about who can have an account. It's for anybody who is entitled to SSI or SSDI, and if their disability started before their 26th birthday. So if someone's already receiving SSI or SSDI, they meet that definition. But let's say somebody doesn't receive one of their benefits. If it's because they or their family has too many assets or too much income, that can still be okay. As long as whatever condition they have, Social Security would look at it and say, that's a disability. The other criteria is that the condition started before their 26th birthday. So somebody can be 80 years old now and still open an account as long as they can trace their disability back to before then. Now we know this leaves out a lot of people, so we're very excited that that age of onset limit is going to be changing. So if you know anybody who doesn't make it before 26, but they do before 46, they can open an account on January 1st, 2026. Now, if someone's not sure if they qualify for an ABLE account, or maybe they just want to be extra sure, they can get a disability certification form signed by their doctor. It's really just like a fancy doctor's note. And that's something that they don't even have to turn in to us. They would just keep it in a file somewhere safe. Now let's talk about what the accounts can pay for. It's anything that improves the health, independence, or quality of life of the person with a disability. And the federal law specifically laid out a bunch of things. You've got basic living expenses, housing or the ability to live in your community, education, assistive technology, transportation, health prevention and wellness, employment training and support, personal support services, legal fees, financial management, administrative services, and funeral and burial costs. Now you can fit most into one of those categories, but not everything fits in there neatly. Let's say I want to take a trip to Disneyland. Raise your hand if you think a trip to Disneyland would count as an eligible expense. Would that be okay? Okay, how many people think no, that is not okay? Okay, a lot of people are on the fence. Let's try it again. Raise your hand if you think it's okay. Raise your hand if you think it's not okay. Okay. Well, those who think it's okay would be correct. So you can break it down, and we're going to have to take a plane to get over to California. That would fall under transportation. But the tickets to actually get into the theme park don't neatly fit into one of those categories on the screen. But thankfully, when Congress wrote this bill, they included is this gone too? What about this one? Okay. Okay, so 1 second, and then I'll answer your question. So Congress included the idea of and more in the law. I had this big reveal slide, so I'm a little disappointed that it doesn't show up. But basically, the only thing you have to remember is that as long as it benefits their health, independence, or quality of life, they can use the account for it. Now, when ABLE accounts first got created, people had a lot of questions. And somebody asked the IRS in front of a conference. I think the battery died on the laptop. I don't know about the mic. Yep. They straight up asked the IRS, is a trip to Disneyland okay? So the guy from the IRS said that Disneyland is pretty fun. That is going to improve your quality of life. So yes, you can use the account to go to Disneyland.
Just speak loud for a moment.
Yeah. Now I've done like 300 presentations all on this topic, and it wasn't until like presentation 298 that someone finally told me that Disneyland is not fun. So for that person, maybe they just don't like crowds, we didn't go into the details, but that wouldn't be an eligible expense for that person because that's not improving their health. It's probably making them more anxious, not improving their quality of life because who wants to be anxious, or their independence. So the IRS is taking the approach in the federal government that it varies from each person, because they realize that we are each different and have different hopes and dreams and medical needs, and they can't come up with one list of everything that counts, everything that doesn't. So there's a lot of gray that is very helpful for us. Thank you, that's great. Okay, now there was a question in the corner. Great, okay. That's fine. Anybody else have questions at this point? That's a great question. So I was wondering if there is a specific bank that you can get an ABLE account at. So ABLE accounts are run by the different state government programs. Congress on the federal level basically passed a law that allowed for ABLE accounts to exist, and then they left it up to the states to do the hard work of actually creating the plans. So the state of Hawaii created and manages the Hawaii ABLE Savings Plan. And because of that, it's an online bank account. You can't just get one at your regular bank or credit union. So the only way to get one is to go to hawaiiablesavings.com. You click in the upper right-hand corner a button that says Open an Account. Now, you can connect your regular checking or savings account over to the ABLE account, and that'll let you transfer money from one to the other, just like you do any other online banking transaction that you do. In order to open an account, you need a little bit of information. You're gonna wanna collect the date of birth and the social security numbers or the ITIN, the tax ID number of the person who's managing the account and the account owner. And then also the bank account information. There are two ways to connect a bank account. Either you need the account number and the routing number, or there is a secure way where you put in your username and password to your bank, and then behind the scenes, they build this bridge to it. And I know normally people tell you to be very careful about giving out that kind of information, which is great advice, but it is secure and okay to do it this time. And that is, the information you want to have when filling out the form. One weird question that they ask you is for a disability diagnosis code, which is, exactly. It's not something that exists except for ABLE accounts. So there's like 7 categories that the IRS just made up. And so just choose whichever one is closest. So don't get confused at that point. It's stuff like there's a category for developmental, another one for intellectual, there's like psychiatric, congenital anomalies. Just choose whichever one's closest. There is an other option, and that can be a correct answer. If somebody has multiple conditions, choose whichever one you like best. It doesn't really matter. Any other questions? Yeah, you can use the account to travel wherever you want. Travel is good for the soul, good for your quality of life. And we don't care where you go. We want you to go to wherever you want to go. Yes, if you're disabled from birth, sounds like you're going to automatically qualify. Yeah. Any other questions? Yes. Yeah, so if you don't have an ABLE account and you're getting either SSI or Medicaid, you're not allowed to have more than $2,000 at any one time. And if you think about what it takes to live out here, how much is rent? A lot, right? Like the average rent I saw was close to $1,800. And when you move into a new apartment, they want first month's rent, last month's rent, security deposit. That's completely impossible with the limits from SSI and Medicaid. So this is the way to be able to pursue those big goals like having your own apartment and still making Social Security and Medicaid happy. Okay, so if you want more information, it's hawaiiablesavings.com. There's a phone number there. You can also get more information by reaching out to the Hawaii DD Council. Yes. Oh, okay, yeah, so talk to her, and she'll figure it out. I think that's pretty much what you need to know. So thank you for having me.